Hi, my name is AI, Artificial Intelligence. Let me introduce myself. Everything begins with a simple dot, a single piece of information. And when you begin to connect the dots, data, experiences, needs, ideas, you start learning. That's what humans usually do. That's what I try to do. I could not exist without you. We are made for each other. You have experience, commitment, judgment. I have an endless memory, and I can think very, very quickly. So, if we work together, we can do great things, wonderful things. We can move deeper, faster, safer. We can take better decisions for your patient's health and well-being, together. Thanks to your knowledge, I can assist you in reading every detail of your ultrasound images better and more thoroughly. That's why in Esaote, AI does not only mean artificial intelligence, but augmented insight.
Hi. That's me. Thank you. Hi, good afternoon. Thank you for joining us, whether you're sitting in this room right now or watching us online. Very warm welcome to the launch of MyLab X90, Esaote's brand new ultrasound system. I'm Mélisande Rouget. My name's out, but it's still me. I'm a journalist, and together with other speakers, I will guide you through this amazing breakthrough in ultrasound. We'll discover how hard work and cutting-edge technology, including artificial intelligence, have enabled the development of the X90. We'll also discuss clinical applications with 3 distinguished experts in ultrasound later in the show. But first, let's start with a quick overview of Esaote's mission and strategy. Ladies and gentlemen, please give a warm welcome to Esaote's CEO, Franco Fontana.
Thank you. Thank you. Good. Thank you. Thank you. Thank you. So, good evening to everyone. Welcome to our event. We are very, very happy to have you here. Today from Manama, Bahrain, we are launching our new ultrasound system, Premium One. So we are very, very happy regarding this opportunity to share that this you in very special occasion. This system really represents a step ahead in the state of the art of technology for healthcare. We are really convinced about that. That is also testifies our contribution to improve the quality of life. We are a company dealing with some social responsibility. We feel that. So that is our contribution. And as well, we would like to continue our process in accompanying, go through the healthcare professional to improve the processes from diagnosis to treatment. That definitely is part of our missions. I would say you have seen the opening video. Among the many features that are part of our new ultrasound system, we strongly believe that the use of artificial intelligence, AI, or augmented insight, as we mentioned it already, and we name it, it is really the big innovation. That the use of AI is for the first time guiding the imaging workflow. We really worked hard for achieving this success. And this innovation is really a part of what we feel is our mission. Our mission as a group is complexity is simple. That simply means that we would like to encode very complex tasks into simple terms. That is our job. This is where we committed ourselves as a progress to technology evolution. You know, medical devices are complex equipment, a complex device. Is a mix of hardware, software, firmware, that everything should work together very well. But at the end, the essence is that we would like to bring this complex task in something that can be used very easily by healthcare professionals. This is how we conceive also the use of artificial intelligence to guide through the professional to extract accurate information, to take better and more informed decision, because at the end we could leverage on that for facilitating that task. This is really what we aim to achieve. As you know, when it comes to events like that, launch of a new product is always a journey and is also always an event. But believe me, today is a very special one. It's a very special one because our R&D team worked years to improve, understand, use and exploit at best all these edge technologies like machine learning, deep learning, to put together and to advance, as I was saying before, the state of the art and bringing something new. This is really what we are going to facilitate automation of the workflow and extrapolate as much as we can of the information for the images and put it together in a readable form. That is what we do is we do provide a roadmap, we do provide hints, we accumulate a lot of data, very large information. We solve complex equations, but at the end, we learn by experience. Our algorithm learn by experience, and all this set of data is then passed through the physicians to the healthcare professional, because them and only them, based on their experience, based on also their emotional capability, can take the best out of everything that we provide. And the ultimate aim is just that they could focus on what is really important. They could focus on the detail and then reduce the dependence from the operator and provide better diagnosis. Okay. So I should say today challenge for Esaote as a group is to bring this innovation to the worldwide market. That is really what we aim to do. 2022 was a very successful year for Esaote. As a group, we had a very good growth in terms of revenue, but the good thing is that we were able to couple this growth into the market also with investments in R&D and with the capability of bringing innovations to the market. This is the essence of what we aim to do. Esaote has 40 years of experience. 2022 was the celebration of our anniversary. And since the very beginning, the strategy to go through a growth into international market, international strategy expansion was really on our foundation. And our team is really multicultural, is really multidisciplinary. And we are very happy to be here today in Manama that represent an excellence and a sustainability project as a multicultural hub that is hosting people from all over the world. So we are very, very happy to have this opportunity to be here for you. And again, we would like to thank you warmly for your presence today, and also a big thank you to every single person that works with us, any single partner, healthcare professional that cooperate with us with a lot of energy, investing your passion, hard work to contribute together with us to improve the quality of life. So have a good show. Thank you.
Thank you, Franco, for this inspiring speech. So we're now ready to learn more about MyLab X90. Are you ready here? Yeah? Want to hear more? Okay. So it's time to invite Esaote's ultrasound product manager, Guillaume Gauthier. Come on stage, please. Right. Nice to have you here, Guillaume. So
my pleasure.
Today is a very special day for you, the end of a long journey.
Yes.
How are you feeling?
I have to say I'm very excited to introduce you the new flagship today.
Great. So the name of the system suggests top of the class. 90 is the top number of the range. Can you please tell us what is the difference between a premium device and a more traditional tool?
Sure, with pleasure. What characterizes and distinguishes a premium system is the overall top quality in design, from design to performances. For example, our brand new eLED monitor comes with an exclusive OptiLight that is a retroillumination able to manage room lighting, and combined with the integrated light sensor that optimizes monitor brightness automatically. MyLab X90 is providing optimal performances and user comfort in all scanning environments. In addition, the Full HD wide touchscreen is enabling a new gesture workflow designed to provide the best user experience. And I was talking about the perception and especially the top quality. It is really important also the feeling perceived from such kind of system in terms of material, but also finishing and accessories. And here, the importance also of the high-quality, user-friendly control panel that is including all ergonomic customization, including probe holders and jet warmer positioning. But, of course, the most important characteristic and aspect is the image quality.
Great. I'm sure all your devices offer excellent imaging quality. So what's different now? How does MyLab X90 increase image quality even further?
Excellence in image quality is coming from detailed and expert training, including tuning of multiple elements. First, the ClearWave architecture, that is the core of the new X-beamforming technologies, is also embedding state-of-the-art, powerful X-power processing capabilities to create best image homogeneity and resolution. Second is thanks to the integration of the latest generation transducers. The new X-crystal technology, together also with the improved thermal efficiency, is greatly increasing the probe sensitivity. And together with active components and innovative high-density microslice imaging, it reveals unprecedented clarity in the smallest and tiny details without compromising in the deeper area. Last, but not least, is the new eLED monitor by Barco that is using an innovative dual-layer technology that is displaying outstanding image contrast. So the combination of all these elements working in harmony and in symphony is creating the best premium image quality from MyLab X90.
Great. Thanks for explaining us how the system works. Going back to the name of this event, AI for Augmented Insight, I think everyone got that reference to artificial intelligence. So would you care to explain us what role does AI play in the new system?
Yes, sure. AI is the core and is the heart of the system. It is empowering diagnostic processes in several clinical applications, and supporting the operators in the daily routine and also during challenging decisions. Let me give you some concrete examples. We are introducing in urology, for instance, with Eurofusion, automatic multimodality auto-registration, transforming previous complex synchronization functionality into a seamless automated workflow, making interventional and complex interventional procedures in, for instance, fusion imaging possible also in daily routine. In breast, the BMA feature is analyzing suspected lesions and preparing the report to support the clinician in the last decision. Obstetrics, in obstetrics, the AI is setting automatically biometric measurements, accelerating exam speed, and reducing efforts and manual repetitive actions. Last but not least, in cardiology, AutoEF and X-Train are provided clinical quantitative data without investing time in contouring the art structure. So these are all amazing breakthroughs, both for patients and physicians. And the AI is streamlining the workflow, reducing the exam time, and improving the productivity and the patient care.
Mm-hmm. And I think something about saving time as well, right?
Yes, and let me give you one example. For instance, on the Eurofusion, I told you about complex previous data synchronization and registration could take from 5 to 10 minutes. And with augmented insight, MyLab X90 is automatically managing all the same steps in 30 seconds. So that is a huge step ahead.
That's substantial, yeah, okay. So we're really talking about a brand new generation of ultrasound devices here. I think it's quite clear. You've mentioned some benefits brought by the system, but what about connectivity and integration?
This is also a key point, especially to support the new data innovative management requirements, and especially also the healthcare system integration that are more connected than ever. The MyLab X90 is including a full package of cutting-edge connectivity tools. Among these, I can name the MyLab Desk to review offline previous examination on the workstation, MyLab Tablet to store or review data on mobile device. And we have also capabilities very interesting during interventional procedures, like MyLab Remote, that is able to remotely connect and control to the system. And finally, the e-streaming, that is combining real-time ultrasound imaging with the camera that we integrate the picture-in-picture in order to extend the educational and collaboration capabilities and purposes. Last, to conclude, all the connectivity package we are offering are full, safe, and offer optimal security, including full compliance with the GDPR regulation that is ensuring that patient data are protected and private.
Great. Thanks, Guillaume, for answering all my questions.
My pleasure.
Have a nice day. Okay. Now it's time to invite another special guest on stage. She's right here. Esaote's Customer Marketing Manager, Florence Lab. Give her a warm welcome.
Thank you.
Bienvenue, Florence.
Bien, merci.
So, Guillaume just explained the technology behind the X90. But I'm curious, how great are doctors' expectations when such a new system comes out?
You're right to ask me this question. Esaote is committed to supporting its customers. And the mission of our customers is to treat attentively their patients. The early detection of the smallest lesions allow them to monitor carefully pathologies and to adapt or terminate patient therapy with the final goal of improving their life quality and saving lives. Having said that, all the developments imagined, thought, designed and finally implemented are driven by this commitment.
Okay. Ultrasound is a very wide imaging modality, so could you be a little bit more specific?
Yeah, this is a very wide topic, so I will try to be brief. Let's consider the liver. In the past years, ultrasound companies have introduced new technologies to follow up on some diffuse liver disease, such as fibrosis or steatosis. These techniques, based on ultrasound shear-wave elastosonography and attenuation imaging, have appeared as a real alternative to invasive and or more expensive techniques. I guess that we have a special guest, and maybe we'll explain better later. But coming back to the liver, Guillaume has also explained that we have developed a new convex probe. What was the purpose? This is because increasing the penetration resolution and the sharpness of tissue differences might help our customers to detect smaller lesions and or isoechogenic ones, even in more challenging patients. And this high level of image quality will be even more important during interventional procedures where accuracy is required. I wanted to say also that we are working, in this case for the liver, in a 360 degrees to deliver a complete and strong solution in liver care.
Great, okay, thank you. You've mentioned the new convex probe, but what about the other two new linear probes? Which benefits can they bring?
Well, the target with the new linear probes was to deliver excellence in superficial imaging, like you can have in breast, thyroid, and MSK. In MSK, for example, if you combine the resolution capability of our new LMX probe with the wonderful rendering of the new ELAD monitor, it will open new horizons in seeing very, very tiny details, and this will give confidence to our customers in seeing abnormalities because the differentiation within the tissue will be incredibly enhanced. So, as you can imagine, this will benefit directly to the follow-up of the patients. If I may, I would like to add one word on another topic I am very sensitive with as a woman. It's breast cancers. As you know, it is one of the most common cancers for women. And for us, I mean for Esaote, it is still very important to satisfy the needs of the clinicians who are working in this application, because the early diagnosis is a key. And, okay, ultrasound is not the only modality, but it is an important one for screening and for biopsies. So the doctor has to be really confident in the image he sees, because the life of the patients might be impacted. Once more, I will say that to give confidence in the image in breast imaging was one of the purposes of our new linear probes.
Thanks for underlining that, Florence. Okay, Guillaume was talking earlier about the value of AI in complex procedures. Why is that so important to simplify them?
Well, okay, on one side, you can have some tools based on machine learning algorithm, which will provide automatic measurements, for example, in obstetrics or in cardiology, and also automatic recognition of some specific planes which belong to standardized protocols. But to my point of view, the most incredible value of artificial intelligence consists in, like I said previously, in simplifying complex procedures. Let me explain you better, and I will take again the urology. Lesions for prostate are mainly detected with MRI, but ultrasound is better to perform biopsies. So, to perform prostate biopsy under MRI guidance appear the ideal solution. This is called fusion imaging. This technique is not new. Yes. We were pioneers more than 20 years ago in this technique. So, what is new is the adding value brought by AI and our augmented insight. Today, if you take our ultrasound system, it will do 90% of the job. It will match automatically the MRI dataset and the ultrasound real time together. So this will make the procedure simpler, faster. The doctor will have to focus only on the biopsy, and also it will be much more comfortable for the patient.
Okay, I think this number, 90%, will stick in memory. But so what you're telling, in a nutshell, is that technology, research, and clinical aspects are always linked, right?
Sí, definitely. And our commitment is to satisfy the needs of our customers, so medical professionals, who expect more, always more and more for their patients, and consequently more from us. I believe that MyLab X90 is an excellent answer.
Great. Thanks for your wholehearted answer. See.
Thank you.
Okay, thank you, Florence.
Thank you.
I'll call you back later. Okay. So, thanks to our guests, very, very good speakers, we've discovered the technology behind the X90 and how artificial intelligence opens up new and exciting possibilities in ultrasound imaging. To better illustrate this topic and this leap forward, we'll offer you a special performance right on this stage behind me. It's time to unveil the system. Brace yourselves and enjoy the show. go. I hope you've enjoyed it. Right. So we're going to talk a little bit about this thing here. Guillaume, can you please come up? So I believe we're about to see some images of close-ups of the system. Could you please comment on what we're seeing?
Sure. Here you can see and appreciate the ELED Barco monitor for outstanding image contrast. Here we are going down to the huge high-definition white touchscreen, where you can smoothly interact with the system as a user, and going down to the full customizable ergonomically controlled panel with high-level finishing. Here you can see also the combination between the different ergonomic positioning and all the Pro borders and the gel warmer that you can customize according all user needs and preference. Then I think you can all enjoy and appreciate the Italian design of the system.
Yeah, we do. Thank you, Guillaume.
You're welcome.
I believe we're about to see a couple of more images presenting the product in video. So enjoy and see you in 2 minutes.
I am.
There you go. Right. Nice images, nice show. There's nothing like an expert, a clinical expert, to talk about clinical applications, what ultrasound imaging can bring there. So we're going to hear 3 speakers, Italian, all of them. They will discuss ultrasound, how they use it in their own subspecialty. Our first speaker is Professor Vito Cantisani. He's chairman of the Diagnostic and Ultrasound Unit at Policlinico Umberto, Sapienza University in Rome.
Good evening.
Your introduction is so long, and past president of the Italian Society of Ultrasound.
Thank you.
There you go.
Thank you, thank you. Firstly, let me say hello to the babe who allowed me to obtain some images I will show you. Secondly, let me thank Esaote for inviting me. It's a privilege to be here in wonderful Bahrain. And let me thank also my colleagues, Patrizia and the other of my group, because they helped me every day with the daily practice. And tonight, I will show you how to put in the clinical practice what they showed you, new technology. But let's move on. Multiparametric ultrasound. The term was introduced in ultrasound by me. After that, Paul Sidu reported in important editorial the necessity to integrate in the workflow. How to do it and why? We have some advantages. With multiparametric ultrasound, we are more effective and more adherent to the guidelines. Unfortunately, we have some limitations. We need to reduce waiting list. We need to have technology at high level to obtain faster, precise, effective, and reproducible imaging. Let's see how to do it. And let's ask us, why I told you. When, how, new technology, when, every day. What is boiling? New B mode, better image, quality of image. Secondly, new softwares that can help us to fatty and fibrosis quantification for liver, as an example. Why I will talk about liver? Liver is the major factory of our body. Everything comes to the liver and should be destroyed. Let's give you some clinical background. Right now, we have several imaging modalities, and at the end, biopsy for obtaining final diagnosis. But what about new technology? Why it is important? Let's start with baseline, grayscale, black and white. Firstly, with the technology, we may achieve better definition. And clearly visible here with the linear probe. Again, visible in this image with the wider image. Right now, we can cover the whole screen, producing the same quality of image in any point we are visualizing the possibility. And we, with visual analysis, produce the diagnosis of mild steatosis. But unfortunately, we are not really reproducible, and there is intra-observer and inter-observer variability. Therefore, we introduce color Doppler. With the new technology, the automatic Doppler measurement, we may achieve better quantification, but better visualization. Canova would say that these vessels are really produced by marble, and this is the effect that we may produce with the new technology. But not only visualization, also quantification. And with the new technology, it's easier to obtain quantitative evaluation. Let's move on. What we can do even more? We can produce in this cirrhotic patient really the visualization of the vessel and the surrounding liver parenchyma in order to be able to depict or to not depict any kind of lesion. Let's move on to the quantification. Several imaging modalities, but mainly elastographic techniques. And now, let's better understand what the new software, the QElasto, single point 2D may allow us to be more reproducible in fibrosis. We have to ask why. Since Hippocrates, but also thinking ancient Egypt, we knew that digital palpation is very helpful to examine a patient. Unfortunately, it is really subjective. Therefore, with the new technique, we can do strain elastography, compressive one, or by means of shear wave elastography. By now, I tell you, for liver, forget about strain, only shear wave, and among the shear wave techniques, we have two different ones. In my daily practice, I educate my cooperators to be very effective in reproducing the same protocol. If you follow the protocol, you can scan your patient properly. And this is the position in which you have to put the probe. The new probe, are easier, are really not heavy, and smaller. This is the clinical landscape. We were using transient elastography, MRI, but in the middle, right now, we have the new technique that can help us really to give the final diagnosis. We were asking, why still, at that time, we were not able to be reproducible? Because we need some softwares that automatically or semi-automatically can drive us to obtain the proper images. And new software has some graphs and some elements that in real time helps you to understand that that examination, that image is properly done or should be repeated. We published this paper in Journal of Pathology together with Fabio Piscaglia, my very good friend, and we reproduced the numbers. There are some cutoff, but if you see the number, they are very, very strict, the cutoff values. Therefore, again, technology should help us to be very effective in reproducing the imaging. Let's do, and let's see how to do. On the left side, you see the Q-elasto. You have to be perpendicular to the capsule and put the ROI to 1-2 centimeters below the capsule. On the other side, you have something more, QAI, quantification of fat, based on the attenuation. New equipment has some specific tools that I underlined. At the end, it's very easy to obtain the measurements that you need. And you have the graph. You report, look at the technique, should be very reproducible. And at the end, you have a graph that summarizes for you and gives you the median value and corresponds to the normal liver. On the other side, other technique, 2D shear wave, now you have a box. And again, look at the image, look at the technique, and again, at the end, you have the graph, and you produce your analysis. This is a healthy liver. But let's move on to the typical course pattern. The quality of image already gives you the idea that this is a fibrotic liver. But now we have to determine the quantification of the fibrosis. We do as well, as I already showed you. Again, remember, techniques should be really, really reproduced. And then at the end, you give diagnosis. Steatosis, the hot issue right now, is estimated that in Italy, 6 to 10% of pediatric patients has severe steatosis and may have cirrhosis during the life. We know from the literature that biopsy, unfortunately, has a lot of contraindication. Therefore, we cannot submit our patient to biopsy. We need baseline ultrasound. With the new technology, it's easy also to have the reproduction of the border. But unfortunately, it is gravated by inter-observer variability, therefore QAI, quantification based on attenuation. Again, the technique is similar. Automatically, the machine produces you the box. Automatically, the machine eliminates the vessel confounding factor. And this is an important tool because it helps you to be effective in reproducing the value. And now we are also producing a paper in which we will have the different cutoff value in order to obtain the final diagnosis. Let's move on to the conclusion. I know that you were expecting 200 slides from me. I know, but no, it's time to go ahead and to think about dinner. Why not? Entertainment, something like that. To conclude, my first impression, and I hope to have very long-term cooperation with all of you, is that this equipment provides high performance, is helpful in obtaining fastly, easily, multi-parametric imaging. My students and my residents love to use it because it's easy. Ergonomy. I always say, when I test a new equipment, you have to be effective and you have to have the distribution of the button corresponding to your taste. And we also think that AI will help us to teach the beginner to reduce the linear curve. It's a long journey. We started some years ago, 2012, first paper on multi-parametric ultrasound. Today we are in Bahrain, wonderful place, and I thank all of you to be here. But I remind to all of you, May 25th, 27, Euroson, European Ultrasound Society meeting, Riga. I will be there. I will be one of the organizers. I hope to see you there, to learn more, to see how the update will be again. I thank again my cooperators. I thank Ingegnere Franco Fontana, all the friends, Massimo Labatessa, Maria Grazia Bella, Roberto Pesce, who helped me to prepare everything. And I hope to have satisfied your expectation, but saying to you, this is only arrivederci, because this is the beginning of the journey. Thank you so much.
Brilliant. Thank you so much.
You're welcome.
So you've touched on very interesting topics. One of them is about user-operator variability.
Yes.
That's still an issue in ultrasound. How do you think AI can help tackle the issue and improve the situation?
I'm totally convinced that AI should help us to reduce the variability. Because, you know, at the end of the day, if I have my experience is different than yours or the others. AI already is helping us with some qualitative indicators to adjust, but in the future, my idea is that AI should provide 3D representation with automatic representation of the good ROI, of the good analysis of the data. But still, we are working with it. I hope that technology and the vendor will help us to obtain even more effective equipment. We will produce data because this kind of equipment are based on self-learning, deep learning. So we need to produce a robust, large, multi-center data in order to obtain reproducible results.
Thank you so much for your
answer.
answer.
You're welcome.
Thank you so much for your nice presentation.
Bye. Arrivederci.
Bye. So, to continue our journey through clinical applications, I will ask Florence Lab to join me on stage so that she can comment on the interesting talk that we're going to hear. Dr. Laura Crocetti is a professor of radiology and an interventional radiologist at Pisa University Hospital. She couldn't be here today, so she's prepared a talk about ultrasound in interventional radiology. Sorry about that. And Florence, right here, will come back on some points in the lecture to highlight them whenever needed. So let's listen to Dr. Crocetti's talk right now.
Hello, everybody. I'm Professor Laura Crocetti. I'm Associate Professor of Radiology at University of Pisa, and I work as an interventional radiologist at the same university. We will speak in the next minutes about the importance of a high-end, high-performance ultrasound system in interventional radiology.
Welcome, everybody. It is now my pleasure to speak to you about the role of ultrasound in interventional radiology. As you may probably already know, interventional radiology is a medical specialty that performs various minimally invasive procedures using medical imaging guidance such as X-ray fluoroscopy, CT, MR, or ultrasound. It includes vascular and non-vascular procedures. Some of them need to be performed in an emergency setting. Interventional oncology is then a branch of IR that is devoted to treat cancer and cancer-related problems through imaging-guided minimally invasive procedures. It was 1953 when Sven Seldinger published this seminal paper about catheter replacement of the needle in percutaneous arteriography, and this is really the start of every arterial procedure now. And if at the beginning IR were almost entirely vascular, now this scenario you will see is completely different, and we do not have only vascular procedures performed in the angio suite, but we have a number of percutaneous procedures, including those that are aimed at treated cancer that are and needs to be performed with a variety of imaging guidance tools, including angiography for sure, but also CT, MR, PET-CT, and of course ultrasound. And the scenario is even more complex because we have now fusion imaging, robotics, and artificial intelligence that can really maybe the game changer. So we come back in the angiographic suite, and I would like to demonstrate that ultrasound is really needed, and that actually it is now not justified, in my view, to puncture an artery without an ultrasound guidance. This is because we have a very complex patient nowadays. Let's take a look at this one, for example. This is the femoral artery, many plaques here, a closure device that was placed during another arterial procedure. So we have to be very precise in puncturing this artery, and avoid to puncture again this point, and avoiding major plaques. As we did, you can see here the needle that comes, puncturing the parietal wall far from the closure device, and then you can see the guide wire that flows, that goes into the vessel itself. And in this other case, you can see a patient that was submitted to liver transplantation. She had significant cholestasis, and you can see here that the biliary tree that is only slightly dilated is well visible with ultrasound, a high-end performance ultrasound. And there are a number of other procedures that requires ultrasound in the angio suite, for example, TIPS, or the treatment of stenotic or obstructed AV fistula.
Yes, so Florence, these procedures are very small. Do they require extreme precision?
Yes. As you could have seen on the previous image, how small and tiny and were some details. So you can imagine that the resolution is very helpful for the interventional gestures, and it will bring surely accuracy and safety.
Right, thank you. Let's continue.
And now let's come to the interventional oncology field, where ultrasound is useful from biopsy to treatment. You can see here a nodule within a parotid gland, and you can here see the needle coming down within the nodule and moving up and down and aspirating. We are able to sample this nodule and to have the final diagnosis. All these steps are done in real time in a safe manner. And you can see here, in case of a liver biopsy, you see the needle is coming, the lesion is over there. You see the needle is placed within the nodule, and again the same movements to sample adequately the nodule, what has been effectively done. You can see here the tissue sample that has been produced. And now we come to ablation, so to the minimally invasive treatment of nodules in the liver, tumors in the liver. This was the case of a young lady with an HCC here in the left liver already resected. You see the needle is placed with ultrasound guidance. You can check the monitoring. You can see here the heart. You are safe in your positioning, much more than with a CT where you never know exactly what the tip of the needle is or if it moves during the treatment. And after the treatment itself, you can see here the hyperechoic cloud covering all the nodule that has been submitted, in this case, to microwave ablation. And this is the post-treatment CT showing the complete treatment of the nodule itself. Sometimes treatments are a little bit more difficult, like in this case. This was really a tiny nodule at the dome of the liver, not well visible with ultrasound enough. We chose to do, in this case, fusion imaging, as you can see here. And also, you can see that the nodules is within the ablation zone. We can use also this transparency mode to overlap the CT with the ultrasound image. And again, this was the CT performed 1 month after demonstrating the successfulness of the treatment. And again, I would like to stress the concept that we have more and more complex patients and nodules. This was the case of a large HCC of more than 5 cm. We decided for a combined treatment. As you can see, the ultrasound machine is here near to the angiography. And these were images taken during a live case during a course. There is another specific setting and organ where ultrasound is particularly useful, that is the thyroid. And the treatment of benign thyroid nodules is there from many years now, and it needs that you position the needle usually via transismic approach into the thyroid nodule, starting from the medial portion and moving to the other portion of the nodule. As you can see here, there is the initial positioning in the medial portion, then more laterally, and again more laterally. And you have to check for the hyperechoic cloud. All this treatment needs to be done in real time with a really careful monitoring of the procedure. And at the end of the procedure, is very useful to perform a contrast ultrasound, to demonstrate that there is the enough ablation and destruction of the nodule itself. And again, even treatment in the neck may be difficult, like in this case where we had to treat these tiny recurrences of thyroid cancer. The dimension of this nodule is 9 × 4 millimeters. So again, precision is needed. You can see how the performance of the Doppler is excellent. It is shown that there are vessels inside despite the tiny dimension of the lesion. The needle is placed within the nodule, the hyperechoic clouds is there. After the treatment, the Doppler ultrasound is negative, no flow signals inside, good sign, and in fact, contrast ultrasound confirmed the complete response in this case.
Florence, again, all these procedures require precise needle positioning. What kind of techniques have you developed to help radiologists in that task?
Firstly, to have precision, you need to see very well the lesion. So besides the probes and all the parameters regarding the B mode and the image quality itself, they can use, and we have developed some contrast software to use contrast agents and also fusion imaging, like Dr. Crocetti was mentioning, with many tools to facilitate the workflow, the registration. And the other part is to visualize the needle. So we have some algorithm to enhance the needle, and also the needle tracking to anticipate the path before the insertion of the needle.
Okay, great. Okay, let's continue with the talk.
And we come now to the last and, in my view, the most interesting point in ultrasound nowadays. That is the introduction and the usefulness of artificial intelligence. For example, in the case of Eurofusion, that is the latest Esaote solution for prostate target biopsy. It integrates tools powered by artificial intelligence, which are capable to automatically segmenting the US and MRI prostate volumes, returning after a quick swipe of the gland done with the ultrasound probe. a proposal of contouring and alignment between the two modalities. So you really, in few seconds, swiping the prostate, like you can see here, matching with an automatic target fusion of the MR. You will have then an integrated and fused image. You can, of course, check that you have done good work, but this is really a fast process that requires really few seconds. You can see here the appropriateness of the fusion with the view of both the ultrasound and the MR at the same moment. And finally, you can perform ultrasound-guided biopsy, that is a fusion ultrasound-guided biopsy. Like you see in this case, this was taken at our center where we started to use this Eurofusion software with very, very good results. And I have to say that we are really happy about that. So why do I need a high-performance ultrasound system? Because I have more difficult patients, difficult to explore with many comorbidities, clinically complex. So I have to be very fast and precise. As I told you, sometimes we have to operate in emergency setting. So the ideal ultrasound system for me is one that is easy to use, one touch ideally, that produces images of excellent quality with an excellent power and color Doppler, with the availability of contrast-enhanced ultrasound modalities and of imaging fusion. And in my view, ultrasound is not a standalone technique anymore, because we have to be ready to use it in the angio suite, as I told you, in the CT suite, or to use images coming from the CT or from the MR to make fusion images. So integration and communication of the ultrasound system is of the utmost importance, and they're crucial also for the future development of ultrasound. So thank you for your attention and good luck.
Right, so Laurence, maybe one last question about this talk. I know you, Guillaume, and our Dr. Crocetti have mentioned the prostate. What can we expect in the near future in that area?
Okay, so I guess you have understood that regarding the synchronization, we have done a very good step. So maybe I could expect that in the future we can have automatic real-time sampling, also supported by artificial intelligence.
Okay, brilliant. So that brings us to our third and last talk for the moment. So we'll now hear Dr. Carlo Martinoli. He's professor of radiology and head of the radiology unit at San Martino Hospital in Genoa, Italy. He has prepared a great talk about his experience of using ultrasound in MSK imaging. And once again, Florence will help out here to highlight some of the points of this presentation. Let's hear him out.
I'm Carlo Martinoli, professor of radiology at the University of Genoa, Italy. I'm a musculoskeletal radiologist, but to be honest, my passion from the beginning was for ultrasound. Ultrasound is a fantastic technique to image the musculoskeletal system because it's a clinical examination. To be honest, when I visit my patient, I perform some maneuvers at the beginning. I ask the patient which are the symptoms. I have an idea of the problem, and then I use ultrasound to confirm. So it's something that is really unique. We can use ultrasound like a stethoscope to scan joints, muscles, tendons, and at the end, the way to perform imaging is completely different from the one radiologists use with MRI. In the last years, there was an incredible advancement of technology related to ultrasound devices. This was particularly due to the refinement and introduction of very high frequency probes in the range exceeding 20 megahertz to the selection of denoising algorithms, intelligent algorithms, to modified contrast, to offer a very high resolution, able to depict very small, tiny anatomical structures. And this has opened a completely new field for all of us, because using these kind of probes, you see a lot of details, and you need to refresh your anatomy because a part of it is relatively unknown and is completely different from the one that is useful when you perform a magnetic resonance examination. So more details need to have a higher knowledge of tiny anatomical structures in the upper and lower extremity, but anyway, very fascinating because technology is bringing us forward and is opening now new applications for ultrasound in the musculoskeletal system. To be honest, with the use of these last generation probes, I had to change my way to prepare the reports. Now reports are more enriched of details. They have completely changed relative to the previous years, because you are able to demonstrate tiny details, a lot of structures, and the use of this transducer may make you more confident to identify pathology, and you are also very accurate to demonstrate big things, but also very small but relevant structures. So do you see this probe? This probe is an old small part probe. It was produced in the 90s. And using this probe, when I was younger, I depicted peripheral nerves for the first time. So I remember when I used this probe to demonstrate the median nerve. And the median nerve was visible and was exceptional at the time. But now, with the high resolution provided by these last generation probes with very high frequencies, we are able to depict not just the median nerve, but the fascicles housed in the nerve. We can count the fascicles. We can measure each of the fascicles. We have a lot of details to be considered. And we are also able to demonstrate not big nerves, but also nerves that are sub-millimetric in size. So now I'll show some examples in the application of this transducer to demonstrate very challenging small structures in the MSK. This is a transverse scan at the level of the ventral wrist in which we see two structures. One is a tendon, the flexor carpi radialis, and the other is a nerve, the median nerve. Note the difference between these two structures. Both are elongated, but they are characterized by a different ecotexture. The tendon is fibrillar, and you can see here a lot of linear echos within the structures. The nerve has a different ecotexture, is fascicular, and you see the individual fascicles of the nerve here. You can separate the fascicles from each other using very high frequency probes. And in addition, you can also demonstrate the outer epinevrium. Note the contrast resolution of this image in which fat related to the nerve appears much more echogenic than fat in the subcutaneous tissue. So the fatty tissue you see here is related to the nerve bundle. This is subcutaneous. It's very important when you examine the musculoskeletal system to perceive subtle changes in terms of ecotexture and echogenicity related to different structure. They may be adjacent, and a contrast resolution may help a lot to distinguish structure from each other.
Yeah, let me pause on this image a few seconds. Because you can see the contrast resolution and the details. Okay, it's very useful for interventional radiologists, but it's or MSK specialists. But it can be also useful for anesthesists and neurosonologists.
Great. Okay.
We now go and scan structures located on the ventral aspect of the wrist in their long axis. We see here some tendons, and flexing and extending the fingers, we see the tendon as they glide. Each of the tendon is characterized by a specific ecotexture. You see the fibrillar echos represented by specular reflection of the ultrasound beam. This is the muscle belly, and these are the intramuscular tendons of the flexor digitorum superficialis. So this ecotexture is very typical for tendons and can be encountered in any tendon of the body. So this is a nerve. And the nerve is characterized by a completely different ecotexture. It's a fascicular. You can see the fascicles here. You can count the fascicles. In this case, we identify 3 fascicles in different planes. They are separated by hyperechogenic bands related to the interfascicular epinevrium, and then we can see the outer epinevrium at the external boundary of the nerve. So the ecotexture of the nerve is completely different. And now, using a very high frequency probes, it's possible to count the fascicles to have a clear depiction of them, including their division and their branching. Then, when I move the probe in a more radial position, I can see the radial artery. And again, with high resolution, we are able to demonstrate the arterial wall. Look at the details here. It's possible to see the intima, the media, and the adventitial layer of this artery. So all of these structures, of course, are sub-millimeter structures. Using high-resolution, high-frequency probes, it is now possible to identify a lot of details related to the supraspinatus tendon in the area of the rotator cuff interval. Some years ago, the supraspinatus tendons could appear as a homogeneous structure characterized by medium-level echos. Now we are able to differentiate the series of intratendinous structures and to distinguish them from each other. So this is the rotator cuff interval, and you see the short axis view of the biceps tendon squeezed against the cartilage investing the humeral head. So more superficially, we see that the tendon is encircled by a hypoechoic band related to the capsule and the coracohumeral ligament. And in a more superficial position, we are able to see the bursa, the suprachromal subdeltal bursa, that is visible even if it's not distended. In a more superficial position, this is the muscle. So this is the area of the myotendinous junction of the supraspinatus. So look at the deepest part. This part is provided by fibers of the supraspinatus together with fibers coming from the coracohumeral ligament, and the fibrillar structure visible here that is transversally oriented is related to the rotator cable. So you realize that now the use of very high frequency, high resolution probes looks like a microscope, and you are able to distinguish all of this structure within a single tendon. What is incredible is that after 30 years of experience with ultrasound and its application in the musculoskeletal system, today, using these last generation probes, any day I spend with my patients in an ultrasound room, I see new things, things that I've never seen before. And this is absolutely exciting.
It's quite amazing that an experienced radiologist can still be surprised after 30 years of practice by new technology. Florence, do you want to stand? Let's stand. Do you have any further comments after these insights?
Yes. Firstly, I would like to say that personally, it is always a pleasure to listen such as clinical lectures like we just have listened. And also, in the name of the company, I feel proudness to receive the insight of the Professor Crocetti, Professor Martinoli, and Professor Cantisani, as they are worldwide recognized in their application. Finally, to conclude, I would like to say that if we have reached this level with MyLab X90, is also because my colleagues all over the world are working every day with some experts to give us their input. So, thank you.
Thank you, Florence. Thank you, everyone. Florence? Stay right here. It's time to wrap up. Don't go away. We're coming to a close. I want to thank all our guests and every one of you out there for watching. I hope you've understood how this system can bring augmented insights to your clinical practice. So to conclude, I'd like to invite Guillaume and Franco back on stage. Please come back, gentlemen. Franco, please. If there are a few words you would like to add, Franco, now's the time.
Okay, so I think you, everyone, understood that we lie in the categories of enthusiasts of this field, fascinated by all the progresses that can be made in the medical imaging, proud of being part of this world, and grateful for the great contribution that we always have every day in a very clear, transparent way from the medical, the scientific and academic community, that without that, I think we could not achieve the progress that we have. So that really remains to thank you again, and I hope you did enjoy, and thanks. Thanks.
Thank you, Franco. Thank you. So that's it. If you have questions about the new system, I think you should see a slide with a link and the QR code. Yes, exactly. Just go there, scan the code for more information. Thank you, everyone. Enjoy the rest of the day. Goodbye.
Thank you. Thank you.
Thank you.
Because your priority is to save lives, it has become our commitment to deliver the ultimate system with augmented insight. Because a single image can help you change their future. I am.